John, what happened to your toe?
Well, I abused it.
I abused it.
So a few hours at a climbing gym in a very tight climbing shoe. I think that it was sore after that, but a few hours after that at home, I jammed it hard against a cabinet, and that's...
After the climbing?
Yeah.
That wasn't enough abuse. You had to...
Yeah, so then I got home and took my regular shoe off, and my sock was all bloody, and so I've been changing out bandages since then.
And what we see is that the nail is actually elevated by the blood that was underneath it. There was enough blood to separate the nail from its bed, and so you're going to lose that nail. The question is it going to be sooner or later? Well, if we don't do anything, it's going to be catching on things.
No, I've been through that before, and I just as soon get it done now.
Put your foot down, and I'm going to spray some numbing spray.
All right.
It kind of gets both sides of the toe where the nerves come through. Here's a shot, sorry. In a sensitive place, by the way.
I really don't feel anything like sharp pain.
Okay, you might hear as I get this.
Maybe I'm speaking too soon, but...
Still not hurting you, huh?
Mm-mm.
And then I need to get a couple other nerves. And we're going to use the 27, which is still a small needle. But this one is longer, allowing me to numb up the nerves on the bottom side of the toe, but accessing it from up here, because it hurts to get shot in the bottom. He's already numb up here, so let's go through where it's already numb. And I'm sorry, I went a little bit too in. There we go. So I'm going to go, you're probably going to feel it again.
Yeah.
It is sensitive down there, sorry.
Yeah, you feel that.
Okay, so with that, I'm going to test for sensation. Can you feel a poke here? Or here? What? No?
You feel a slight tickle there, or
Do you feel a poke here?
you feel pressure.
Pressure, but it wasn't sharp?
No.
What about here?
Pressure.
Am I hurting you?
No. I feel pressure.
I'm going to separate the nail from the skin over the nail, and that will allow us some freedom of the nail. I'm not hurting you?
No, it's a little more sensitive. I definitely feel that. As a tug.
Feel the tugging? Yeah, there's a lot of traction being applied here.
Yeah, that's kind of sensitive.
How bad?
Tolerable right now. That hurts. That hurts.
That hurts?
Yeah.
This is the supplemental anesthetic locally.
Feels fine, yeah.
We're giving you lots of anesthetic. Now, too much anesthetic puts people at risk for seizures and heart arrhythmias. We're not using that much, though. We're okay. We're like half of the limit.
Right.
When he starts stinging or seizing, give him the rope. That we talked.
And the drug.
The master and commander rope we talked about earlier.
We probably won't put this online.
The seizure part?
Yeah.
Can we edit the seizure out?
Yeah.
Okay, now we're back.
Be able to practice
Because
medicine.
the ending that we recorded earlier.
Feels like it's up towards the tip of the toe.
So let's look underneath here. And all right, John, we got something for your doggy bag here. So this will continue to heal, and there'll be a little bit of oozing or bleeding. Keep an eye out for signs of infection. If there's increasing redness or swelling, red streaks up the leg, pus discharge, fever, anything like that, call me.
All right.
But apart from that, we'll just keep a loose dressing on it to collect any drainage there is. It should be very little. Now, you could also have a a fracture of the very end of the toe, the bone in there.
I noticed
But
it was pretty purple.
there's no different treatment for that other than pain control, the recommendation for a hard-soled shoe, and you can take over-the-counter pain medicines for that.
All right.
So until next time, this is John and Dr. Mark Vaughn telling you to stay in good health and don't smash your toe.